Hey everyone, this is Richard from Anyreach Roundtable, where we give you the insights from leading experts in the space around AI, the trends, and how to stay on top of the new additions and innovations in AI. I'm joined today with Ed Marx, an author of Voice of Innovation and Healthcare Digital Transformation, which are bestsellers, LinkedIn Top 25 Health Influencer, the podcast host of DGTL Voices, which is ranked number 3 globally on Spotify, has held multiple C-level positions across the different hospital networks, and served 15 years as an Army combat engineer and medic. Quite an impressive background. Welcome to the show, Ed.
Richard, I'm so thrilled to be part of Anyreach Roundtable. Thank you for having me.
Absolutely. Thanks for being here. So first, you've had an amazing career and journey. Can you maybe share with our audience your background and what led you to where you are today?
Yeah, I was born and raised in Germany and came over to the United States when I was 10. So that was a pretty interesting experience, learning a different culture, learning different language, all that sort of thing. And I was really fascinated by being part of a new country. And then I started to grow up a little bit and trying to think about what I wanted to do in life. I knew I wanted to pursue the military, and so one thing led to another, and after I graduated from high school, I needed a little bit of extra money to afford college, so I joined the Army Reserve, and they basically said I could be whatever I want, and I had this experience in high school where I was a janitor in a medical facility, and I knew my calling was not only to do something in the military, but also do something in healthcare. And so when they said I could be anything I want, I chose combat medic. And so I became a combat medic, and that really reinforced this whole concept of my destiny. Like, man, I know it's healthcare. I don't know exactly how it's going to play out, but I know it's healthcare. Remember, this is a 17, 18, 19-year-old mind now thinking. And so you're just trying to figure out the world and that sort of thing. But I definitely knew it was healthcare. And things sort of progressed in life, and I graduated from college and things like that. But the healthcare bug still pulled at me. And so I decided to apply at the local hospital. This was in Fort Collins, Colorado, for a position. And I finally was able to get a position as an anesthesia tech. And wow, I was working in the OR. It was just amazing just to see patient care, to see clinicians, just to see operations and operational things, how they work. And I was like, I am definitely all in on healthcare. It took a little while. It was a little frustrating as I was married now and having kids and not making much money because I was still sort of in the lower part of my career. And I finally got a big break working in physician relations. So this was part of the strategy for the hospital. And so that was my first salary job. And again, it just reinforced why I was in healthcare. But I still wasn't at the point that I knew, aha, this is exactly it. Well, I was helping the IT department. They struggled with communication, but they had this great tool that would allow clinicians to see real-time information from anywhere in the world, kind of like table stakes today, but think about this was 30 some years ago. And they had very little adoption and utilization of this technology amongst the clinical staff. So they asked me to get involved because I'm quote unquote physician relations. I got involved. We went from 5% utilization to 95%. And I saw the power of tech and clinical work. And then our next daughter was born, and it was a very difficult birthing situation. I won't go into detail for the sake of time, but she was at death's point and nothing was going to save her. And then I thought, wait a second, if we had the children's hospital that was a couple hours away, if they knew what was going on with my daughter, then maybe her life could be saved. But how could they know without life flighting her and then separating her from my wife, who was in the hospital herself because of the trauma of the delivery? So I was like, aha, let's send this engineer from the IT down to the children's hospital, load up the software, use modems, and allow those neonatologists to see real-time data and help bring my daughter back to life. And that's exactly what happened. It was at that moment I knew my purpose in my career was to leverage technology in clinical care to save people's lives. And at that point, I changed my job. I got into healthcare IT, and then successive positions as CIOs led to where I am today.
Got it. Wow, that's quite an amazing background, and the mission and vision of where you're headed obviously hit home personally.
Yeah.
And that's the first time I've ever heard technology being used in such a way where you can bridge the gap between patient care and a really amazing outcome. And I mean, it's great to hear that, your daughter's doing much better, and
Yeah.
what a father you are to, figure out that gap and really kind of execute and ensure she got the care she needed. So, well, first of all, thanks for sharing that. And just kind of going to the next topic. We've talked about, or you've talked about, the heart and head of digital leadership in healthcare. In today's AI era, what qualities define a strong healthcare leader?
Yeah, I always think that the role of a leader is, in fact, to do that, to connect what we know in our heads and brains to the heart. That's when digital transformation happens. You can have the best technology, but if people don't really understand it from the heart, you're going to get a B minus outcome, maybe a C. But if you have people where you connect the heart and have average technology, you can still get an A outcome because that's how powerful that is. So I always focus not so much on the tech, but on the heart and then making those connections. And so I would leverage multiple different techniques in order to make that happen for those who served with me. And as a result, everywhere I've served, we have had extraordinary outcomes. And it's not because of the tech, although the tech was good. It was really about connecting head to heart. So that's why I'm all about it, especially in the age of AI and advanced technology and how we get distracted pretty easily. It's all great. I love the tech, trust me, and I'm sure we'll get into it. But what I care about the most is the person in their heart, because the rest will follow.
Right, right. I mean, I think, we're at Anyreach, we're seeing this where, I think the prevailing trend is that AI is, this cold, robotic tool and solution that's going to replace all of humans. But really, it comes down to whether it's customer service, sales, or any other kind of function that, having a human in the loop. And as you mentioned, the heart, the human aspect of technology is really going to accelerate not only the adoption, but also the acceptance mainstream. And, at the end of the day, it's the outcome of how you're utilizing that tool and technology ultimately to make the human experience better, right? So,
Yeah.
and as we kind of talk about digital transformation and hospitals, healthcare, we see a lot of organizations investing in digital health tools, but they struggle with execution. From your vantage point, being in the space for so long, what's the biggest blocker to successful digital transformation in healthcare?
Yeah, I think there's maybe two or three, so it's hard to limit it to one. But definitely culture is probably the biggest. And that is, are people ready to adopt the new technology? Not because the new technology is hard or difficult to understand, but we'd like to be settled in our ways a little bit. And we're pretty happy just going along the way things are. And so when someone comes up and says, look, we're going to be doing things a little different, you're like, oh my gosh, my job's already stressful enough. Think about it from a nursing perspective in healthcare. There's so much pressure put on nurses, and we've added all these technologies and literally bells that go off and alarms that go off. And then pretty soon they tune it out completely. We call it alarm fatigue. It happens to all sorts of clinicians. And we think from a tech point of view, wow, this is great because, we're going to improve quality, improve safety. But at the end of the day, it still comes down to the human element, as we already touched on. And so people naturally don't want any more of this tech. So it's kind of a cultural thing. So we need to work differently and explain things differently and introduce things differently to sort of overcome those cultural barriers. And so there are a couple of different ways that we do that, right? Is we include nurses. Like if we stick with the nursing example, we include nurses in all of this and in the design of things and in the explanation of things and in the leadership of things. And that way it's nurses speaking with nurses and nurses who understand what the implications are of this technology. And then so that's one of the ways that we get around it, and that way we can really work within the culture, and then show because that's going to lead to, oh wow, let's kind of rethink this entire process and how technology can actually reduce alarms in all of this. Then you'll see from a cultural perspective more interest in adoption, and I think you can get to the place, and I certainly served at places where at first, people were very resistant to new technology, but at the end of a couple years of working, doing all the things I just shared, they're like, what else can we do to, improve the experience, improve safety, and all sorts of things? So I think that's probably the biggest one is the culture.
Yeah, I mean, I think you bring up a great point of, having the customer in that sense, or the user, this being the patient, being the nurse, having their buy-in and feeling like they have a voice at the table.
Yeah.
I think that's super important. And, especially for an industry like healthcare where you have, physicians and nurses, where you actually physically have to be there, right, to serve the patient. It's not like you can just AFI or create a digital experience where you never have to interact and have that human element. And so, their buy-in is so crucial for, the adoption and the feeling of comfort as you're developing these new kind of digital transformation offerings and so forth. So,
Yeah.
and we've seen this also very similar with other industries and other functions, if you will, where if you get the customer service rep or the sales rep to be involved in AI development, AI kind of design, it doesn't feel, the conversation kind of
Yeah.
switches from I'm having a bias of you're trying to replace me to being, hey, I'm actually part of this process, and how do I get more involved versus being very skeptical and against kind of the new change. So,
Yeah. Richard,
um,
let me give you a second one because it's
yeah,
kind of provocative and maybe your audience would enjoy hearing it. And that is the other obstacle. I mentioned there's, obviously more than one, but the culture being the biggest. But one
mm,
more, pretty serious as well, and I've seen it in my own career, is that some of the decision makers who are involved are not innovative themselves or do not understand technology themselves. So when you,
mm,
as maybe as a direct report or sort of a secondary leader, you bring something to the table like, oh, there's this new AI capability and we can really do. I mean, I had this happen everywhere I've been, where we had some new capabilities and I was so excited about it because I knew that it was a game changer for us. So it would improve our revenues, it would decrease our operational costs, and I would bring it forward, and there was like no interest. And so I really did a lot of deep introspection, like, wow, what is wrong with me? How come I'm not getting through to my peers
mm,
or to people that I report to? Why aren't they adopting? And then I realized, whoa, wait a second. When I travel with them, they don't use electronic keys. We're at the Marriott or wherever, they're still
yeah,
getting the physical key.
right.
We're getting on the airplane. This example is a little bit more dated, but still happens. They're using a paper boarding pass. And these are the people that are making the decisions about how we're using AI and other technologies.
Mm,
Whoa, they were the ones still using flip phones. They were the ones resistant to bringing in Apple products into healthcare. So sometimes that's the biggest challenge. It's like
mm,
you're dealing with people who do not understand. And if they don't understand something, their natural reaction is going to be say no, right? Because it's the
right.
unknown. And so you have to really think about, as a leader, how do you work with people like that? And it's sort of the same thing. You kind of have to pull them aside privately and show them these new capabilities and why it's important and what the
Mm.
results are. But that's a real one. That's why I wanted to mention it.
That's a great point. I mean, the buyer and the user are usually kind of different, especially for
Yeah.
healthcare and enterprise. And we've seen the same thing. We call it the pen and paper industry in
Yeah.
some sense,
Yes.
right? Where even for some of these hospitals, for instance, for a call support, they think an IVR is the future, right? Press one for this, press two for that. So some hospitals don't even have that set up,
Yeah.
and it's pretty amazing because that's been around for 5 decades. And
Yeah.
as a caller, when you're calling in, I'm pretty certain everyone hates the IVR menu. But
Right.
for some of these buyers, they're like, "Oh my goodness, this is cutting edge technology. This is the
Right.
future, right?" So
Yeah.
sometimes it does require a little bit show and tell for them to experience it. Like when we demo our voice agents, when they hear it, they're like, "Wait, I was talking to an AI this entire time. Can you imagine what we could do with this?"
Yeah.
And so, yeah, sometimes it requires a, hey, sit down, just try it, and then have your mind blown. So,
Yeah. The other thing, just being really practical, Richard, not trying to take us off our game or here or anything, but one thing that I always did that also helped is I would
mm,
bring my C-suite. I once a year, I call it the West Coast swing because typically the more progressive, some of the more progressive companies we were interested in,
mm,
anyways, were on the West Coast. So I call them West Coast swing, and we would travel for 4 days. I won't name the vendors, but we would land and have dinner with a vendor that was doing innovative things, and they would talk about the innovative things they're doing. And then the next day we'd have breakfast with them and spend half day at their facility. And then we'd move to lunch with a different vendor. And then the afternoon we would look at their facility, stuff they were doing in healthcare and non-healthcare. And then that night have dinner. And then we did this with 4 or 5 companies on a single trip. So at the end of that week, yes, we're exhausted, but now the C-suite, they were tired of hearing it from me. They're like, oh, Ed, you always say that stuff because you're the CDO or CIO. We expect you to do that way. But now they heard it from the CEO in some cases of these, Fortune 10 companies, or even if it wasn't the CEO, someone really influential, someone they could relate to, and they would bring examples from outside healthcare. It would really open up their eyes. That's one way. I always like to bring not just the problem, which I did bring you 2 problems, but also the solution. So this is one solution to that, to expose them at very high levels to organizations that are on the cutting edge like yours.
Got it. Well, here's a little fun thought exercise. I don't know if this would ever happen, but a similar approach to that. What if you invited competitors of the company that you're chatting with to come in and say, here's how we adopted XYZ tool. I'm pretty sure they'll be all over like, oh my God, our competitor is doing it. We got to do it too.
Yeah.
I don't know if they would ever take that meeting, but be kind of a funny little thought exercise. And just as your background as an executive and also a patient, your time in the Army as a combat medic, how have these personal experiences shaped your views on the intersection of tech and care?
Yeah, tremendously. So there was nothing like seeing things firsthand, like as a combat medic, now I never was in combat. I want to be clear about that, but I still provided medic services outside of combat. And so seeing things firsthand and I was 17 years old, was quite eye-opening. And then also working as an anesthesia tech that I mentioned, so there was something about that really changes your perspective, and it takes it from theory to actually, wow, these are humans, and this is why the job's so important. And we're not just talking about widgets here, we're talking about people's lives, So I've always continued that, Richard, and that's another practical thing I always try to share with people, is that you can have those similar experiences. So how I did it over the course of my career, because I know I was like working my way up as a CIO, in the ivory tower and that sort of thing. And I was like, I never want to forget. So I volunteered every week, and I included my kids when they were younger and living at home. I volunteered by myself every day, like even at the Cleveland Clinic, every Wednesday at noon, I would take off my suit coat, and I had an hour-long appointment. I put on my blue vest, my volunteer vest, and I'd walk over to our cancer hospital, and I would hang out with people getting outpatient chemotherapy, just talk to them, provide comfort to them, drinks or blankets or whatever. And that was fascinating, talking to them, and I talked to the clinicians as well. I even went a step further, and I took a shift once a week from 5 a.m. to 1 p.m. in the OR, back to my anesthesia tech days. So I still did my regular job, but I also did this one shift, and I saw patients all the time, obviously. I was in surgery all the time. I saw clinicians all the time. And that helped me remember, my gosh, at the end of what I do, this is just not widgets. It's just not, cybersecurity. There's a reason for all of this, and it's that patient's life right there. And so I was constantly reminding myself, there's other tricks that you can do, and I made my teams do all this too. Like you can round regularly. Rounding is, the act of just like walking around a hospital on a regular basis. But I made everyone do this at least once a year, spend an entire day with a clinician, including my administrative assistants. And I'm telling you, that's what makes a difference, Richard, and everything that we're talking about here, back to the head to the heart, is the reason our teams were so good and so well rewarded, and we always made the top 10 list for everything, wasn't, again, because we had the greatest tech. Is because they all understood the mission, why we were doing what we were doing, and they had the heart to do it, and so they outperformed every time.
Well, that's amazing. I mean, just being boots on the ground and staying close to where you came from, and being in the battlefield in that sense, right? Where you stay close to the action, and that makes for better buy-in from stakeholders because they see you're just as committed, and you also learn quite a few things. I mean, it's very similar to how Jeff Bezos, even though, Amazon grew quite a bit, he was still taking customer support calls, once every once in a while, just to make sure that he really understood his customers. So that's amazing. And as you kind of think about AI gaining momentum across healthcare, from clinical decision support to maybe patient experience, where do you see AI having the biggest real world impact over the next couple of years?
So I think we're going to see more on the side of diagnoses, earlier diagnoses detection, because that I think a lot of the data exists already today. Like if they were to do like extreme data capture of either one of us, and then
Mm,
look also at our family histories and also look at our DNA and where
mm,
we live and how we live, they could pretty well know what's coming around the corner and we could take preemptive action as a result. But that's not the way it is today. Even though that data exists, we have really no meaningful way of gathering all that data, and then no one's got the brain power to figure it all out. And I
mm,
think we're going to get better at that. I think we're going to get better at customizing our medications or our solutions, our prescriptions.
mm.
So today, you and I, we go someplace and they're gonna give us the same medicine, the same dose.
Right.
Well, we probably shouldn't be getting the same dose or the same medication, and maybe it's a mix of a certain medication and a different dose. But it's like one size fits all, pretty much. I mean, I'm overstating it a little bit,
Right.
and I think we're going to be much more customized in our approach, and so I think we're going to get better outcomes. Another area where AI has been leading for 20 years, but I think it's going to get even more precise, is the whole area in imaging and understanding the images better and allowing
Mm,
our clinicians to work what's called a top of license. So they just work on the ones that are coming out as abnormal,
mm,
where you really want that level of human understanding. So I think we're going to see a lot more there. And then I think on the experience side, I always, my heart is always out for clinicians as well, because my wife's a clinician and she spends an inordinate amount of time after hours, with charting and things like that. But everyone's moving to ambient voice,
mm.
capabilities and understanding. And so I love my most recent visit to my physician. She has ambient voice, and now she's looking at me while she's talking, and everything's being recorded. And then ultimately, I think what's going to happen, and this was my prediction a few years ago, there'll probably be some sort of listening device in a clinician's ear. And so as they're taking in the input, it's being processed again against all of our DNA, all of our family history, all the latest medical research, right, which they cannot keep up with.
Right.
And it's going to prompt them for the next best question. All right, based on
Mm,
everything we know about Ed Marx, his DNA, his family history, and this latest studies that came out of the medical journals,
mm.
here's the next best question. And I think we're going to get to that level. One final example, only because I thought of this when I was working in the OR. There's still a lot of errors in the OR. There's still a lot of manual things in the OR that happen, which if we had a better AI capabilities in the OR, even including ambient voice, would make a big difference, because ambient voice could pick up on the fact that, hey, did we do all these different checklists that we're supposed to be doing? And it would alert you in real time. No, you didn't. Or it's like, hey, you had 33 sponges in that body and you only pulled out 31, and here's exactly where they are. Sometimes they do the count and there's a
Right.
sponge missing. They have no idea where it is.
Mm.
So I think we can do a lot in the OR as well. So I think healthcare can really benefit. And, there's a few organizations that are more progressive than others that are starting to lead the way. But I'm looking forward to seeing that accelerate.
Yeah, yeah. No, I mean, that's a great explanation of where kind of healthcare is going to be in the future, especially around AI. I mean, Ed, I don't know if you know, I actually started a genetics company about 8.5 years ago. And I had this vision that there was going to be a omics revolution, because genetics, your microbiome or metatranscriptomics, to your exposomics, which is like environmental, with toxins and metals and so forth, that was actually going to be a predictor of our health. A lot of the testing today, the gold standard of blood tests and so forth, it's really kind of after the fact. If something is broken, it
Yeah.
doesn't really tell you why. But I think being able to marry all that data together and ultimately be able to show, how susceptible someone is to a specific type of disease, and then, personalizing the treatment, what they call maybe designer drugs, right, for
Yeah.
each individual to get a better health outcome. So definitely looking forward to a future like that. I know there's a lot of data in healthcare. It's just being able to capture all of it, clean it up, make insights, and then, obviously make the clinician and the patient's life much better moving forward. So. And so you served on many boards and advised top leaders. How should healthcare boards be thinking about AI governance, adoption, any risk or any opportunities?
Yeah, so I would love to see the boards become more tech savvy. So
Mm,
a lot of traditional boards are made up of people who may have a lot of money to give, which is great, or they come from the legal and finance perspective. There's
Mm.
very few that have a deep technology understanding. So I would love to see boards, start bringing in some individuals who have deeper tech understanding and more
Mm.
education for current boards on tech understanding. I
Mm.
used to laugh because one of the people I used to report to back in the day, this was back when airplanes still had like magazines in the back seats, and
Yeah.
they would read about the cloud, and then they would come back and like tell me about what are we doing with the cloud, and they were like an expert because they saw an ad on the back cover or something, and
Right.
that's the extent of a lot of board members. Not the ones I serve on. I serve on great boards with all my board members are very acutely aware of what's going on with the tech inside of our hospitals. But
Mm.
I think generally speaking, though, they're not very well aware. So I think we need to do some massive education and improve the number of people on the boards who have a tech background, and then they'll be better positioned to comment on and recommend, advise on governance. So I think the board should definitely be aware of what's going on. And again, I think back to my hospital boards, we are aware. There's a report given. The CEO always knows. It's kind of funny. He always like has it in the back of his pocket, figuratively. Like we're
Mm.
doing 73 projects right now that are related to AI, and this is what we're doing. But I think it's really important to have some sort of governance. I'm not like huge, like being overly bureaucratic, but you want to know that there's not some rogue department out there, because that's always happened in healthcare, whether
Mm.
we're talking about AI or some other technology, a rogue department out there that's doing some things with, let's just say, with LLMs that have a lot of bias in them, and then we're
Mm.
making decisions on patients, based on bad data. And so
Mm.
that would be really bad. So you have to have some sort of governance, some sort of controls around to
Mm.
make sure that everyone is leveraging AI appropriately. And finally, as goes with everything in a health system with finite resources, you want to make sure people, there's finite resources, finite dollars. You want to make sure we're spending it on the high priority items that are aligned with the mission and vision of the organization. And so having some sort of structure really helps with that.
Got it, got it. So, the moral of the story is buy a lot of magazines with ad space on your company about technology, and you're gonna hit the board of the healthcare companies,
Yes,
right?
because they're reading paper. Yes,
Right.
they're still reading magazines.
We're gonna buy out New York Times, every newspaper, every
Yeah,
magazine, because that's how you reach the decision
yeah.
makers. But yeah, to your point, I think education around technology, around AI, and it seems like the evolution of when the adoption does happen from the board level, that hospitals probably need to start thinking about if we're going to actually adopt AI and deploy it. Probably needs to be a whole AI team around governance, guardrails, data cleanliness, patient experience, and so forth. So, seems like quite an undertaking, but I think the end benefit is that ultimately the hospital gets better improvement in terms of its KPIs, and the patient gets better care. So,
Yes.
and so as someone who shaped the past and is now helping shape the future, what excites you most about where healthcare is headed?
So I love the whole AI, initiative. I love the focus on experience. I'm hoping it hasn't waned a little bit, and I feel the same way with virtual care. So hopefully those two things can continue. So I mentioned three things. So what excites me is, yeah, AI for sure, for all the reasons we spoke about and the examples
Mm.
that we gave, and things that we don't even know about today, I'm sure are coming. And so
Mm.
whatever we can do to become more efficient and help prolong life in a healthy way, where it's good living, I think is going to be pretty cool. I want to see virtual care recycle itself and really take off. During the pandemic, we saw a great acceleration, but after the pandemic, everyone went back to the way it was. It was really weird how quickly we went back. That kind of shows you the culture thing we talked about in the very
Mm.
beginning. We quickly went back. It's like, gosh, are you kidding me? Because we could save a lot of money. All of our studies have shown, and I led this as
Mm.
well. So I know from firsthand experience that when you do virtual care well, you reduce the cost of care by over 25%. You
Mm.
improve the satisfaction rate of both clinicians and patients by some 25%. Everyone wins. No one wants to be in a hospital. It's a dangerous place. You want to be at home. So if you can convalesce at home, stay at home, that's the best thing. Why we're not fully there yet. I just don't understand it because the tech is there. I do understand it. It has to do with payment. We haven't really modified payments to reflect this sort of technology, and also it goes back to the culture and change resistance. And again, you have leaders who don't use virtual care. So if they're going into the hospital and you're coming up as this young person, or you could be an older person, but person with new ideas, and you're saying, hey, we could do all this at home, and they don't do that at home, then it's not going to have any traction. So
There's a huge disconnect, right?
And that's a bigger thing, Richard, than maybe it's the biggest thing of everything we spoke about is who is making the decisions. It's people stuck in the old ways. You can't put new wine into old wineskins, and that's exactly what we're doing. So, so exciting. Okay, again, virtual care, the AI, and the experience, the focus on experience. And so we had this big push, how to differentiate yourself in the marketplace by providing a better experience not only for the clinician but also the patient. And so we talked a lot about what are they doing in other industries, how can we emulate that, how we can make the same thing. But we sort of lost momentum there as well. We reached the high point. We definitely have come back. And I think part of the reason is because, again, the way healthcare is delivered in the United States is you're sort of told where you can go. You're within a network. You really can't, even though you get a better experience across the street, your insurance company is only playing here. And so where are you going to go? You're probably going to go here because you can't afford the better experience. And so I think healthcare systems realize that. So when it comes to budget allocations, they're like, it's not going to make a difference. But it does make a difference to the soul of a person and maybe probably their outcome. But to them, we're still a big business machine.
Yeah, that actually brings up a really interesting question. I mean, I'm Taiwanese, right? But I didn't grow up there. But the healthcare is very different than in the U.S., right? Yeah. And I know for China, it's also very different, where it's a lot. The technology is more adopted for healthcare, where China completely skipped the PC era, went straight to mobile, and payments is done through mobile, checking into your hospital. Everything's just like super efficient and seamless. But the U.S. seems to be kind of stuck in this state of affairs, if you will. Based on your experience, kind of being in the space, have you seen how that's kind of shifted? And what have you seen as like some winners that are not in the U.S. that maybe we can start replicating?
Oh, Richard, this is
Just open up a whole can of worms.
Yeah, explosive conversations. But yeah, well, I think one thing for sure is we don't take enough self-responsibility for our own health. We know that if we eat and consume or smoke certain things, we're going to need hospitalization.
Right.
But we still do it. So I think number one is we got to somehow reach people and just let them know, and I don't have an answer for it, that, wow, what you do matters. And it's more, I just saw a study that came out today by Eric Topol, famous cardiologist. He's always coming out with new studies. I think he came out with a new book today, maybe on how to live longer and stuff like that. And he was saying something like, it's not genetics. A lot of times people say it's mostly genetics. He's like, it's not mostly genetics. It's your choices, And you're seeing that play out now in politics as well. And I know it's very controversial, so I won't name names or anything. But you've got some leadership that are saying you got to make better choices, and people don't want to hear that. So that's one thing. But I think we don't use all of our resources as well as other countries, right? Because I don't have the stats on top of my head, but I know it's something like we spend twice as much per person than other countries, but have worse outcomes. So like we spend twice as much as Taiwan government does, and they have better outcomes. So how is that possible? And so, I don't have a solution for it. There's a lot of politics involved, but it's also the way of business. And I'm a big free market person, so I hate to do anything, opposite of free marketing, capitalism. But there's got to be a better way. There's got to be a better way. And people have tried. We're on this path of population health. We're on this path of value-based care. But I think, so those are the good paths to take to get to where you and I would like us to get to. But I think at the end of the day, we still got to figure out how do we make the individual responsible. And whenever you do like tight controls, people, struggle with it, because you could say, well, if you continue these bad behaviors, then you're not going to get, this certain level of care. Because you would do, well, then, that opens up a whole nother thing. So it's a hard hard thing to tackle, and that's why we've struggled as a country for so many years, because it's so hard to tackle. But I think we can learn models from other countries. Not that any other model is perfect or not, but there's something to be said. If you're spending a lot less and your quality is higher, maybe we should look at that.
Right, right. And yeah, I mean, that was kind of an open-ended question, so I apologize for making it, posing this on the podcast. I mean, there's so many other industries related to healthcare, not just your hospitals, but even the food industry and how that impacts and the choices we make, right? I mean, it's just a multifaceted beast, if you will. So, all right, well, awesome, Ed. Thanks for providing such incredible insights into the healthcare industry, your background, and giving our audience a view into how AI is potentially impacting and growing the trend of healthcare and its adoption of the technology. If our audience wants to connect with you or learn more about your work, where can they find you and where should they go?
Yeah, well, thanks, Richard, for having me on Anyreach Roundtable. I really appreciate it. Yeah, and you can find me on LinkedIn, and on LinkedIn you'll find my website and all that kind of stuff. So if you had to remember one thing, is like remember my name, Edward Marx, on LinkedIn.
Just Google me and you'll find everything you need. Well, awesome. Thank you, Ed, so much for joining us, and appreciate you being on.
Thank you, Richard.
Absolutely.